We are recording. Hey, Jason, how's it going in Thailand, man?
Good, good. Everything's good. How about you in LA?
Things are beautiful in LA, man. It was raining earlier, but it's a lovely day. And I recently read an article that LA has the cleanest air it's ever had right now.
I can believe that. Yeah, I mean, there's really no pollution anymore. No, I guess probably less traffic as usual. Probably the 405's pretty clear now.
Yeah, I've gone on the 405 and the 134, and it's pretty dead, man. It's never like that.
Yeah, but well, at least that's good, in terms of traffic.
Yeah. So, hey, everybody, I'm Isabella Pasquale of Alpha Fantana LLC, and I'm with my associate, Jason Yo. And we, for the past several months, we've been helping a bunch of folks out. So, Jason, what are we doing?
So we are basically helping people with PPE all over the nation, all over the world. We focus right now more on masks. We have surgicals and the KN95s. Which we just got a shipment into Los Angeles. There's one of our KN95s right there. We also have some other KN95s we're bringing in, which are going to be packaged differently. Those are actually going to be, I think, like 100 per box. Yeah, that's also the surgical mask that we got to Los Angeles. So we're focused on that. We have a few deals in hand sanitizer. There's some more masks right there that you're showing. So those are pretty much all our products. Whatever people need, we'll work on getting quotes. We'll work on getting whatever it takes to get the product, over here to America to help people. The majority of our products are great for the general public as well. California right now, I'm not sure if it's a law right now, but there's been a thing where they're saying that you have to wear a mask when you're out in public.
On April 7th, Eric Garcetti, he made that announcement that in Los Angeles, everybody must wear a mask when they're shopping. So a lot of people nowadays, they are buying cloth masks from different friends who are hand sewing them. However, that offers no protection. Our KN95 masks, they are freshly manufactured direct from our manufacturer and shipped to medical facilities and to personnel. These masks do have an expiration date. If you look at the actual, if you look at the date of production here in our mask, it says March 5th, 2020. These are brand new, freshly manufactured from our factory, which we're directly working with. A lot of other suppliers, they can have a number of units that are stockpiled for 5 years, and those are already expired. And I wouldn't risk your family using those masks. These are freshly manufactured, and they're fresh from the factory. They come to you. They offer your family complete protection. This is our KN95 mask right here. And it says the date right here of manufacture is March 6th, 2020. These are freshly made, your full protection.
That's right. Not
to mention, we also have the industrial 270 gallons of hand sanitizer, which is 80% ethyl gel. That weighs 1 ton, and it's delivered directly to your factory, medical facility, or wherever it needs to go. We also have some gloves, and we're working on booties and other surgical medical supplies as well.
Absolutely, 100%. Yeah, right now we're more focused on the masks, which that's the number one thing people need. Pretty much all medical staff need it. Pretty much now general public needs it as well, with the new laws coming out. At the rate things are going, with California leading the pack with the new laws of the masks. I wouldn't be surprised if the whole nation's heading that direction as well, where it's going to be required for pretty much everyone to wear a mask at all times out in public.
And projections say that this global quarantine could last between 6 months to even 18 months. So it doesn't hurt to have a supply to protect yourself and your family. Now, our KN95 products, they come individually wrapped. Everything is sanitary, and everything is FDA certified. We have our medical grade surgical masks as well.
Yeah, so whatever the product is, masks, surgical KN95s, hand sanitizer. We're working on getting gloves as well next. So we're also working on speed. So that's the other difference. In general, a lot of people, you look on Amazon, look at eBay, things like that. You'll have people selling them, and they'll say shipping around May. So I mean, if you want to wait 2, 3, 4 weeks, that's up to you. Even the masks you have right there in your hand, those were made, last week? Was it last week they made them, or last month?
It's March 6th. They're freshly made.
Yeah, freshly made. So yeah, we get them straight from the factory, straight to people's hands. Generally for us, it's anywhere between 3 to 7 business day turnaround time. So it's, obviously people need these masks yesterday or ASAP. So that's our main focus. Our main focus is speed. We want to keep the quality up as well. We want to make sure that the products are good quality, have a lot of good protection as well. So that's what we focus on. We focus on the quality and we focus on speed. One main thing too is a lot of other competitors, other people moving masks around. So, of course, some of the quality may not be as good as ours, but the other thing too is a lot of times you'll get a quote from these other companies, and what they'll do is they'll give you a quote and they'll add on customs, they'll add on other things, other hidden fees that you don't see. With us, it's an outdoor price. There's no hidden fees. There's no hidden anything. And we get it straight from the factory, straight to where it needs to go. So straight to the facility, straight to the door. It doesn't land at the port. It doesn't stop there. It goes all the way to where it needs to go, the facility or the door. So that's one thing to watch out for when people are looking at other places. You want to get the outdoor price to your facility. You don't want to get the price to the port, and then you have to figure out customs. You have to figure out how to get it from the port to your facility. So that's one thing to definitely look at.
There have been a lot of cases around in 15 states actually, where nurses have been protesting a shortage of PPEs. Now, I don't see where we can solve that shortage. We have our supplies direct from our manufacturer. Everything is FDA certified. There was a case in New Jersey of a nurse who she processed an order herself of $12,000. She used a crowdfunding campaign to raise $12,000 to order thousands of units for her fellow staff, and the hospital suspended her. That should not be the case at all.
Yeah, no, that's definitely not. That's where we've gotten to now with the hospitals, where not only they're not providing the staff the PPE, but then what's the staff supposed to do if they can't even do a crowd fundraiser and try to get it themselves? So it's definitely a bad situation. But at least we can help solve that situation. But the issue is getting the approval through the hospitals as well. Mm-hmm. We have the product and we can get it shipped fast.
No, we have the product in hand. Everything is FDA certified. We offer 5 to 7 days of international shipping direct to your medical facility. We also have an expedited option as well. We have a client in Washington State who they ordered 5,000 of the surgical masks. Within 2 to 3 days. Now, it depends entirely on volume. So we have an available inventory. So we're able to provide 3,000 units to them in expedited shipping. Now, we can provide whatever quantity you need within the 5 to 7 day period. However, the expedited shipping is subject to available inventory.
Inventory, right. Yeah, if we have inventory lying in America, we can kind of look around, see what we have available. And if someone cannot wait, generally we say 5 to 7 business days for shipping, not next month, not 2 or 3 weeks, but we shoot for 5 to 7 business days. A lot of times the PPE does make it faster, between 3 to 5 business days. But if someone needs it right away, what we have to do is a search for inventory within the United States. And then once we figure that out, then we can get it out to wherever it needs to go, generally within 2 to 3 business days. So that's definitely a lot faster than 5 to 7. And we do have that option as well. So if someone can wait 5 to 7 business days, then we can do a much larger order. If they want something right away, we can also piece it together too. So for example, like the Washington State, for the 5,000 they needed, we had the 3,000 ready. And then once we get another 2,000 or however many more they need, then we get that out to them as well.
In New York, there were 125 New York police officers who they contracted COVID-19. I believe there were 300 first responders as well who contracted COVID-19. So we have a steady supply. We can provide the solution and the prophylactic measure to protect everybody.
Exactly. Yeah, all the police, all the fire department, everyone needs to be protected, especially if they're out and about, doing what they can to protect everyone else. So they need to be protected as well.
Mm-hmm. And if you guys are all about fashion, if you want, you could wear one of these. You can get a marker and you could do an illustration if you want. Or you can also, if you wanted, attach some fabric or wear a bandana on top for fashion sense. But this is important. This takes precedence for your life. You need this. You need this protection.
Exactly. Yeah, that's the first layer of protection. A cloth mask. I mean, if you just have pure cloth, I mean, that's not going to really protect you from the viruses. But sure, for fashion, you can do the KN95 underneath, surgical underneath, and then you can put the cloth over it. So then you can have the fashion and you can have the protection underneath. But the main key is we have the KN95s and the surgicals. So that's we provide the protection, and then if someone wants to get creative with their own fashion, then that's totally up to them. No problem. You can be unique. You can put a bandana over your mask. You can put a t-shirt over your mask, cloth, anything you want. Mm-hmm. So make it a little bit different.
Now, Jason, I just want to read a few statistics right now that are happening in the United States. So according to the United States Conference of Mayors, 91% of cities do not have adequate supply of face masks and PPEs for first responders, including police, firefighters, EMTs, and medical personnel. 88% do not have adequate supply of PPEs to provide workers. 92% do not have adequate supply of test kits. 85% do not have adequate supply of ventilators for use by health facilities. 62% do not receive medical emergency equipment or supplies from the state. So we are here to help you out. We have our supplies direct from the manufacturer, since we are direct suppliers working with our manufacturer. We're not leveraging AliExpress or other platforms like a lot of people are using.
Or Alibaba, yeah, exactly.
Exactly. We're working direct from our manufacturer to provide people with the help and the essential supplies they need.
Exactly. Whatever they need, we got it for them. And if they want something else specific, we've even had requests for other types of PPE as well. If there's something specific, we can look into that as well. Do our own research. We have our boots in the ground in Asia, going around to look at different factories for different PPE. So if a specific facility needs something else, then we can also try to do what we can for other products as well.
As far as the rest of the country, people are hunkering down, and there are some curfews in place around the world. Jason, I'm sure you can tell the viewers about the state of things in Thailand. There's a curfew, right?
Yeah. So Thailand during the day, people are still going to the office to work. That's still happening. There's still a decent amount of traffic during the day, but then once it's past 5, 6 o'clock, things start to wind down. There is a curfew at 10 p.m. No one's allowed out after 10 p.m. unless it's a medical emergency. Otherwise, if you're just out running about, or if you're doing something that you're not supposed to be doing out after 10, you could actually be put in jail or get a fine in Thailand. There's definitely some sort of, it's definitely an offense to do that. So it's not a good thing. But yeah, so Thailand, what they've done is when I first got here, you could still eat at restaurants. They closed down the bars and nightclubs. All the restaurants were fine. And then the day I got here, they did this thing where they did social distancing at the restaurants, where they sat the tables 6 feet apart. So I was in this one restaurant. It was completely full of tables and chairs. And that same night, they started moving all the tables and chairs around. And they had it all, they separated all the tables and chairs. So by the time they were done, there was 4 tables in the whole room. But now there's no dining in at all. So all restaurants, it's all takeout. The mall is still open. The mall only has a food court open. So basically food, pet stores, drug stores, things like that. Those are all still open, but the clothing actually is all shut down. Electronics is shut down. 7-Elevens are still open. So pretty much during the day, you have offices. Most of those are still running. So a lot of things are still running in Thailand, but the main thing that they're doing is they're shutting it down at 10. I think for the whole country, there's maybe about 30 people that have passed away, unfortunately. But Thailand's been pretty strict on controlling everything, and hopefully it works out here.
Yeah,
which it should, because they're extreme. It's pretty extreme measures. I think there's about 2,000 or 3,000 infected. We can check that on Google as well here in Thailand.
That's not a bad ratio. It's much more dramatic in the United States.
Yeah. It's I left right around the time when it started getting bad, and I think they were talking about closing down the first casino in Vegas, and that's when I decided, yeah, it's definitely time to go. I can't sit around here anymore. I already know what's going to happen. Yeah, I already know what's going to happen. So at the time, I think Thailand had maybe 2 people that had passed away. So, and that was about a month ago. It was March 16th when I left.
So far in the United States, there have been over 12,000 deaths. And I've actually had, there's 4 people that I personally know, including 1 family member that have passed from COVID-19.
Wow.
Yeah, there have been
I'm sorry. Sorry to hear that, Isabella.
Yeah, I appreciate it, Jason. There have been some other projections that there will be 100,000 deaths. I'm not a scientist, but we can look into that. There have been some other projections that have said that this will last globally for another 6 months to possibly 18 months.
I can see that.
Yeah, in which case you guys need a reliable supplier who provides direct to you freshly manufactured PPE products as well as hand sanitizer. We can deliver internationally anywhere. We also have our sales team in the United States up in Sacramento, Los Angeles, in Colorado, in New York, in Texas, and abroad. So we can supply products to anywhere in the world. You get them direct from us. We're here to help you out.
Exactly, 100%. That's what we're here to do. We saw the need for the masks and the PPE, and that's what we're here to do. We're here to help people get protected.
Yes, sir.
With quality product and as fast as possible.
Yeah, this is quality made, freshly manufactured from our manufacturer, and we deliver it right to you in record time.
Exactly.
All right. Well, Jason, thanks for your time. We have some more orders to fulfill, but you can contact us and we will get some orders to you. All right, folks. Jason, anything else you want to say?
That should pretty much do it. Definitely stay protected. Thanks for the call, Isabella. And that's what we're here to do. We're here to help everyone get protected. A lot of people are wondering where to get a mask. They're getting, they get a lot of random news on, now they have to have this mask for going out shopping. Maybe it's at all times, maybe even they're in their car, who knows what's next. But bottom line is COVID is not going anywhere soon. We definitely need to stay protected. Just like you were saying, if it's going to be here 6 to 18 months, we definitely need to get all these masks out to pretty much every single person who ever plans to be outside. So, and that's what we're here to do.
If it's a matter of inconvenience for most people, Our KN95s are freshly individually packed. They are solidly constructed, and these can be reused. A lot of people are resorting to those cloth masks or bandanas, which offer no viral protection. Let's say if an infected individual were to sneeze on you or something else were to happen, then that mask is compromised. These are not compromised. These are KN95s, the ones that you need to wear to protect yourself, your friends, and family.
Exactly. Yeah, the KN95s and surgicals are definitely better for viral protection.
Well, folks, you know how to reach us, and stay safe.